Hey, Off-White Coat listeners, it is my privilege to get to tell you about this sweet deal from our friends over at Picmonic. If you haven't heard about Picmonic, it is a fantastic picture-based mnemonic platform that can certainly help out any student. Most of the videos are around 2 minutes long and provide a quick and effective way to memorize material for any upcoming medical exam. It is extremely efficient. They have this search bar function where you can search playlists on general topics like renal to step 1 to step 2, or even first aid and other books. If you want to review the Picmonic for later, you can even make a playlist of your own. Picmonic even has this repetition algorithm that is spaced out according to your learning needs. This helps with increasing long-term retention and allows you to review the right information at the right time. One of my favorite functions is the quizzes that are associated with each Picmonic. I'll take the quiz first and then learn about the associated pictures and what facts I need to sharpen up on. Honestly, Picmonic is a fantastic tool, and if you use our code OFFWHITECOAT, you'll get 20% off. That's Off-White Coat with no spaces. So what are you waiting for? Make studying the easiest part of your day. Sign up with Picmonic and use Off-White Coat to save yourself some money. Hello everyone and welcome to the Off-White Coat podcast. Today I have a special treat for you today. In Grenada we called him The Process. He was one of our stars on the Shockers. He began as a friend. Now he's become my landlord. Welcome everybody to Joel Collins.
What's going on?
What's going on? Indeed.
New and improved, baby.
Yeah. So I am now currently up in New Jersey, and I have an ER rotation up here. And Joel has been kind enough to let me stay with him. He's now my new landlord in the House of Gaines. Joel is a proponent of protein shakes, protein chips.
Everything protein.
Everything protein. When you look in his cabinets, everything has like a little bit of protein, like a little bit extra protein in it.
Yeah, yep.
I love it though, actually. It's good to always like start, because I had been eating unhealthy for a little bit, so I was like, oh, thank God I need to get back in shape.
I was sitting last night in the ER pod and I was like, oh my gosh, I think I have a kidney stone. And the attending's like, tell me about your pain. And I was like, well, it's just like every time, like I said, I can't get comfortable. Like every time I move, I feel it. And he's like, that's not a common presentation of a kidney stone. I was like, yep, you're right. You know, whatever. It's like, it's my fourth day.
Yes, that's what we should bring up, is the fact that Joel is now an ER resident. And he has had his first shift, so he's officially a resident now.
Yes.
Yes. How was that first shift?
You know, honestly, the first shift was just like getting used to the EMR and like Epic and stuff. But I feel like it's not even about the medicine at that point. It's like, because you have your attendings, you have your seniors. You're trying to figure out how to document everything, how to see a certain amount of patients at one time, learning like what you can and can't tell nurses to do, or like text to do, or like, you know, like, do I call a family? Do you call the family? Like, how do you consult? The list never ends. So you're kind of always in this frantic mode of figuring out what to do or how to do something. Mm-hmm. So like getting my feet wet, no, like they threw you in the deep end and you're just like, you know, you're learning how to swim again. So
now that you have that doctor badge though, that's got to feel at least a little nice. Like instead of just having the one little student badge that barely has your picture on it, now you're official. You got all the 7 badges or whatever that usually come with it.
It's so weird. Like, I didn't really notice it until last night. I was like, why is everyone so nice? And people look at you when you're walking in the hallways of a hospital. Then you see them with your eyes. Look at your badge. They look at you. Hi, doctor. How are you? I don't even know you. And they're just very nice. I mean, maybe it's like I'm just getting used to the culture. So I'm just trying to like figure everything out. And it's just like, it's weird. You're like noticing all these new things, you know, putting in orders. You're like, oh my gosh, you know, can I order the Tylenol? Can I order the, you know, bag of fluids? But I mean, you know, it's like anything else. You just, you know, you learn and you keep moving on.
People always have a different aspect once that code gets a little bit longer. And then talking about the Tylenol, it's like that episode of Scrubs where the resident goes and asks the attending if he can give her the Tylenol. And he's like, she takes more than this every day. You know, he just yells at her. He's like, take as much and just throw it at her. And whatever lands sticks. Like, he's just so mad. I was like, but yeah, so you've had your first shift. How was the orientation process before? As a student, you really don't know everything. Like, things change drastically when you go from a student to the actual MD residency. Because even during rotations, I guess people need to understand that you're just sampling a bunch of different specialties. You're not really learning everything that you need to know. And then once you get that residency, it's game on. Everything from that point is that style of medicine.
Yes. I mean, I think the biggest thing for orientation was they're just like, okay, like these are the two big things you need to know. And like, it's like you want to get down your process on how to like intubate patients and how to do central lines. Cause like in the ER, it's all about stabilizing like patients that come in, right? You have sick or not sick. So from that standpoint, I feel like the only real like upfront training we got was that. There was expectations and whatnot, and you get so many emails and you can't keep up with the emails whatsoever. But all the training modules like HIPAA, all of that stuff, it's just overwhelming, all of the information you have to fill out and do. And then on top of that, it's like after you do all that paperwork, you're still continuing to do paperwork. And then you also have to see the patients, and then you're also sleep deprived, and then you're also having to present and figure out everyone's names, do the presentations to your attendings properly, get to know the nurses, get to know the staff. And it's like, it's so overwhelming that like, you just can't, you're just drowning at first. And then, you know, hopefully eventually I'll start swimming, but you feel like you go into work and you're just, all right, I'm drowning again today. Here we go.
Right from the start, like they just threw you in the pool.
Yeah, I mean, and they're nice about it. They're like, at my program, the reason I chose my program is because everybody was so nice, right? Mm-hmm. And, you know, that was something that I really valued in a program. And they told me that they're like, we don't hire people that we don't get along with or that we don't think would be a good fit. And everybody that I've asked questions to so far, nurses, attendings, techs, they've all been so nice. You know, I said, hey, my name's Joel. I'm one of the new residents. I have no idea what to do or like, can you help me with this? And everyone has just been super nice. Yeah, sure. You know, let me show you. So I think was really important was, you know, based on instinct, picking the program that you want to go to. And just like the vibes you get, I think was really important because everyone was saying like, trust your gut. Like, and I did, and it ended up all working out. They always say it always works out, but you're like trust the process. And I hated when people said that, but it was like such a long process. And then you're here and then you're like seeing patients and putting in orders and you're like, is this real life? Like, this is my job. Mm-hmm. As I'm sitting here having my first paycheck in front of me, I'm like, wow, $969 for my first couple of weeks.
Woo! First paycheck is in.
Party.
Oh, that's awesome, though. So did you get to meet like the attendings that you would be working with when you were doing your interviews and everything? And that's what chose you to choose your residency?
So part of it is they actually had a bunch of the different, they even had like one of the neurosurgeons stop by the Zoom to meet some of the candidates. And, you know, they were like, listen, no one's going to yell at you over the phone as a new grad calling a consult. You're not really sure what to say. Like, no one's going to yell at you. That's not the type of program we run. And so, you know, I don't know. I just felt like everyone was very inclusive, understanding, and like made you feel comfortable. And that's what I wanted. I didn't want to feel like I was being berated for like not knowing something, because that's always like a bad feeling.
Yeah. That's the scary part about being the ER doctor, is having to call and admit and consult. That's a heavy part of your job. And their attitudes back at you can be kind of scary.
What's even funnier though is what I'm noticing is like, I'll like pick up the phone. There'll be like 7 or 8 like attendings or like residents or fellow doctors in the thing. And I'm like, do I call myself like Dr. Collins, or do I say I'm one of the new ER docs? I said, no, I'm not going to say I'm the new emergency resident. And I'm like, I'm just going to like say less and be straight to the point, and then they'll ask anything they want to know. And so sometimes I'd be sitting there on the phone for like 3 seconds, like with dead silence. I'd be like, so what do you want to do? And I was like, oh, that's why I called you.
Yeah. You're like, I need you. Yeah, that's got to be a little bit nerve-wracking. And then they're listening, too, because they want to see how well you do.
Yeah.
And so you're sitting there like, oh, no. Yeah, when you call someone and then you say, hey, I'm the new resident or I'm the student, they immediately look at you with a different lens. They're like, oh, okay. Do we need to go over what this guy's going to – are we going to have to micromanage what this guy's doing?
No, it's even true, though. And what's nice is, you know, it's all about how you phrase things. Like when you're trying to like get an admission, push for a patient to be admitted. We admitted so many patients last night. And the internal medicine doc at our hospital was like talking to one of the seniors in like the chat and was like, oh my gosh, like you're crushing us tonight. What's going on? And like he was giving him like a little bit of pushback on patients. But for me, I was just like, he didn't give me any pushback. And I was like, I wonder why he's not pushing back. He's like pushing back against the guy he knows more. But to me, he was just like, all right, sure. I accept the admission. So I don't know. It's just like learning what you can and can't get away with, what to do, what to say, when to say it, who to talk to get what you want. And a doc looked at me the other night. He's like, just like anything else, it's a game. If the patient's sick, but there's no room on the floor, but they need to be admitted, it's a game. You have to fight for your patient to put them where they need to be. And he's like, that's the next level. Now you're like a fish out of water, but it's like finding that there's a whole new pool to swim in after, you finally get your feet wet and you're like, what the heck? So
that's a great way to say it though, because I've actually seen that too, is where people will give you that pushback and then you got to kind of fight for it because you get to see the patient, right? In the ER yesterday, they were talking about that it's pretty unique about the ER is you get to see patients in like very unique situations, even like a flash pulmonary edema. The people that in the IM floor, they don't get to see them when they're coming in and you don't know anything about them and they just passed out on a bus stop somewhere. They came in, they can barely breathe. And so most of the time you're seeing people in a very unique position. That ER docs were using that as an example because they were like, they know that presentation. Mm-hmm. They've seen that, but the other people don't see that side of that condition.
Exactly.
You will see the other symptoms, and it's been like 8 hours before all the specialists and everything have gotten to see 8 hours of care before the specialists have gotten to actually see the patient.
And listen, like the ER docs are like masters of stabilizing people, right? So by the time you get the call, you sit down at your computer and you're like, you've stabilized a patient, for instance, right? And you put that consult into the internal medicine doctor who's like got to accept the patient or surgery. By the time they come down, I mean, they're not always stable still, but that's why you're calling, right? But you've gotten them to a point where they're like borderline,
that you
right?
Can call them.
That you can call them, right?
Yeah.
Exactly. So I just feel like like you said, it's a really unique position to be in because you have to really like explain to people in the nicest way why they need what they need.
Yeah, it can be pretty unique being an ER doctor. But yeah, they started you on nights, right?
Right.
How's your schedule look like for the rest of the month? So when you start nights, what time do you start?
So my hospital does 12-hour shifts. So I would go in at 7 p.m., sign outs at 6:45, so you arrive 15 minutes early. I hate people who are late. Never be late to your shifts. That's the most annoying thing when you're tired after a 12-hour shift.
And you have sign outs and stuff? Yeah.
And you have sign outs and the person comes late. Like, that's a slap in the face. That's also like a big, communication thing for me with like my co-residents. I told them like, my big thing is please just don't ever be late. Like people's time, you're never going to give that back to them people. So just don't be late. Show up early and stay late is always, the more conservative and better way to go. They said this to me on the first day. It's okay if you know nothing and you're nice, but imagine knowing nothing and being a jerk.
Yeah. I pray to God nobody thinks about me like that.
Right? And it's so, but then once again, think about that because you're also navigating that as a new doctor, right? Is you really just don't know anything. And every button you click, you don't know if like when a message comes up on the computer, if you're going to like kill a patient because you clicked the wrong button. And you have that fear. And I feel like that's a real fear you have as a new doctor. And, it's terrifying, but like it's just part of the job.
That fear will make you a better doctor in the long run, though.
1,000%.
Because you're going to pay attention to what you're doing instead of just clicking things and being like, oh, they'll be fine. You'll pay more attention to everything that's going on.
Yep.
And I think that's a good thing. So what are your responsibilities as a first-year intern, I guess? Okay. Which I hate the word intern because you're getting paid.
Yeah.
But But you
matter.
also don't know anything. I don't care about the title. I thought interns don't get paid in the business world.
Yeah.
Whatever.
Yeah. I mean, it's different so you get paid less normally as an intern, right?
Yeah.
PGY.
It moves up every year.
Exactly. It's not much, but it's something. And so, I mean, like, there's little, like, it's not hazing by any means, but it's like, you're a first year and there's a lack, you take care of the lack. You know, so you go and do the laceration. But someone taught me this in med school. I thought this was always super important. They said, if a senior asks a favor of you, get something out of it. Even if you're a student, right? If there's a doctor and you're a medical student and this doctor is asking you for a favor and he's a resident, get something out of it. Use it as a bargaining tool. Hey, yeah, sure. No problem. But can you help me with this or teach me this also? And I used that strategy last night. My senior was asking me, he's like, hey man, I've got a lack. And I was like, okay, yeah, no problem. But hey, question, I've got this guy that I think might have he's got right upper quadrant pain. I've never, do I do the bedside ultrasound? Do we do it? And then do we send him for a more official read? How does it work? He's like, oh, we can ultrasound. He's like, do you feel comfortable? I said, I haven't done one in 6 months. So if you could come, he's like, sure. I was like, all right, I'll do the lack if you come show me the thing. He's like, all right, let's do it.
That's awesome.
So,
that's exactly the bargaining, though. That is a efficient professional relationship.
Yeah, and just being nice about everything. That's the biggest thing too. Is just being nice. You can't like I said, if you're nice and you know nothing, it's different than if you're a jerk and you know nothing.
Is there some procedures and things that you can't do as an intern that you would be able to do?
I mean, listen, you're not thrown into the deep end as of that soon as an intern. You still have if you have done a ton of central lines or something before medical school or before, if you've done a couple of things, if you've done a couple, a bunch of central lines before residency started, then, I'm sure they're going to be comfortable, letting you go do a central line. If you know everything, you can explain the procedure. But even last night, the guy was like, my senior was like, if you can set up everything, you have all the tools and you can show me that you can do it, I will let you do it. And so I was going through with him this is my intubation procedure. He's like, okay, all right, that's a solid amount. And he's like, do you know where everything is? I said, I have no idea. He's like, so you need to look in the cart. You need to find out what's where, what you need, and, go from there if you want that procedure.
That is half the battle, if not more, is having to go find every single thing that you need and get it all there before you actually start doing any kind of sticking or doing anything. Because it's usually not just one piece that comes in. Thank God if it comes in a tray, but everything doesn't come in a tray.
No.
So, yeah, it can be so difficult. Even yesterday, I remember I went to just get vitals, and I couldn't find a machine that had a temperature thing that worked.
Yeah.
So I had to leave the room 3 times before I was like, this is
stupid.
Everybody thinks I'm stupid now.
Yeah.
Even me.
Yeah.
I was like, what is going on? And you can't tell until I get in there, plug it. I was like, oh,
but that's the hardest part about rotations too, as a med student, right? Is if you're rotating in a new hospital, you have a month to be impressive. And if you're only rotating 15 days out of the month, your first 4 shifts are just finding out where everything is, what to do, how they like to do it. It's nearly impossible. So that's why I always advocate for in these rotations is being nice, being humble, being a nice person, someone that can bro out with people when they know what to do, when to do it, where to stand, not being overbearing, all of those things, and having a sense of self is you're 5 out of 10. You're halfway there if you can do those things. Mm-hmm. And then if you have a little bit of medical knowledge, you can present a patient okay. They're like, oh, 7, you're 8 out of 10. Okay. Then if you start crushing presentations, diagnosing, and the doctors can trust you, you know what? This is a guy I think I'd really like to hang out with. You know?
Yeah,
so,
I think that exactly how you said it, because the 7 to 8 crushing things is only 1 point to 2 points. You don't have to do that. You have to be a good person. First, you have to be likable, I guess, more than a good person. You have to be able to, just casually, you have to also introduce yourself to everybody. There's so many people that I know, and I catch myself too, because I just don't want to get in people's way, especially when they're working, because I know that that's hell annoying, that somebody's just hello, want to... Yeah, of course, every student is saying the same damn thing.
But even in passing, right? If you're passing a new face, hey, I'm Joel. I'm one of the new ER doctors. I just wanted to say hi.
That's
You know,
exactly what
that's
I do.
it.
I stare at them until they make eye contact with me, and then I go, "Oh, sorry, I just didn't want to make awkward eye contact." So I was like, I might as well introduce myself.
That is awkward, though.
I don't actually stare at them. I wait for them to kind of glance around the room and then make quick eye contact.
Yeah.
I'm like, "Oh, we just made awkward eye. Hello." You know, I just say hello. You know,
Yeah.
Put me to work, please, because that's all I'm wanting.
Yeah.
Is like if I need, like, I would rather you put me to work so that I can prove myself that way instead of me just trying to bro out immediately.
Exactly.
You know?
Exactly.
Because that's half the battle too. Is you have to do things. You have to do it multiple times before you're good at anything anyway. Like presenting, and like you almost go through. At least for me, like I had to go through almost most of my rotations before I started just like getting the whole flow. Like I could get everything in one. Like,
and it's different from rotation to rotation. What I feel like the general public doesn't really realize, though, is like as a med student, like your first 2 years, yes, they're all bookwork. You're a complete nerd. You study for tests, blah, blah, blah. But then you're in the hospital and you're having to learn how all of these different specialties work. And like you're getting a feel for the type of people you're dealing with and then what you're actually responsible for. And even like an internal medicine doctor came down. He was like, he was a fellow. He was internal medicine fellow. I don't know what's, in what specialty, whatever. But he came down. He was so smart, and came down. All the ER docs were just listening to him, even the attendings. And this guy was like an internal medicine fellow, and everyone was listening to him. It was like, oh wow, like yeah, wow. And they're like, so what would you do about this? It's like these guys like know what the heck they're talking about a lot of times. And I'm not saying the ER docs don't. Their specialty is just different.
Yeah.
So you're constantly hopping around and like figuring all of that out. And it's even like present in the later days of being a doctor too. Like, and you see all these stages of like of medicine, being a med student, getting thrown into the deep end, figuring everything out. And it's just nonstop. You're always learning. And even as an attending, I'm sure it's going to be terrifying because when you're a med student, they're like, your first 2 years are going to be the toughest, right?
Yeah.
And then someone's like, oh, the third year of med school is the toughest. And you're like, what? And they're like, no, intern year's the toughest. And then all the interns are like, the people that were just interns are like, being an attending is the hardest. You're like, when does it stop?
Yeah. That's the truth though, because it's all the next person's always talking about how hard it is at the next step. And you're like, I thought I already did the hardest step.
Yeah.
Getting in. Yeah. I think that the best physicians or even just the best medical employee or whatever, the best caretaker are the ones that know people from different specialties. Like because you can't learn everything about every single thing. There's just not possible.
No,
but there's so
possible.
There's so many opportunities where someone comes down and bestows a little knowledge on you. And that's one of the beautiful things about rotations is you going to all these different places so that like, for example, my OBGYN rotation, they showed me, they realized I wanted to go into emergency medicine or do trauma in general. So they were like, let us show you what not to call us for. That's going to be the whole goal of your rotation. And I was like, okay. And that was
do the pelvic, right? Do the pelvic exam before you call us.
We will show you exactly how to get this done.
Yes.
And I was like, oh, okay. So now I learned from them, like exactly because where other people are confused.
Yeah.
And so I think the best way is to where you're outreaching, and you have to, almost be like a community and learn from other people. You can't.
Well, that's just what's so great about, and like those vibes are super important when, when you're interviewing at programs and meeting the people. It's like they said, we only hire nice people here. And I haven't met anyone that hasn't been nice. And I just can't stress that enough. It's like working with, like we were broing out over cryptocurrency last night, stocks. I actually have a stock tip right now. Yeah.
Oh yeah. We'll have to get to your hustles.
Yeah, but like talking about
Next
all
segment.
that. Yeah. Okay, so no problem. But we were just talking about everything just like super chill in between patients. And I think that's also like a big part of just being able to get along with people in ER too, is like everyone's just normally so chill. Even during codes, like no one's like freaking out. It's like, I don't know how to explain it. The vibes.
No, they are very chill. There was a guy that was losing his mind yesterday and it took like 9 people to hold him down. Calmest you have seen anybody in the ER.
Yeah.
Like they were just like, a regular Thursday.
Yes.
Is there a procedure that is your favorite to do?
So I feel like when I was in medical school, I felt like my favorite procedure was just suturing lax, because it was something that I had learned to do in med school, and it's actually something that you feel useful and needs to be done. And guys, never use epinephrine on the nose, toes, or in the GU regions, meaning like genital urinary regions. Okay, Lido with epi, you don't use in those regions.
Yeah,
okay?
That's an important pimp question, right?
Yeah,
there.
they'll ask you, "What do you want to use?" And you'll be like, "What?" You know?
Yeah, nose, toes, and fingers.
Yeah, fingers. But otherwise, you're safe to just use Lido without.
And you want to use the epi when it's a real bleeder.
Yeah.
The beautiful thing about suturing lax is the fact that
you have autonomy.
You have autonomy. You can prove yourself a little bit because they don't really want to waste. That takes a little bit of time.
Yeah, they have better ways to use their time, right?
But if you do a good job too, the healing process is different too. Yeah.
For the patient,
it looks good compared to
exactly. I had to suture this guy's eyelid lac the other night, and I was like so nervous because like the skin above the eye is so
and it's thin.
It's thin, right? And I was like, man, I haven't like done many of these things. And I was like, the skin here is like really thin. So like the scarring, but like you can't like you have to know that first and then realize you can't like be cinching the skin. You have to use a small suture. You have to be gentle. Like, so I don't know, just all these little things you're always learning about different procedures. But I like the suturing for the autonomy in med school.
Is there one that you fear the most?
One that I fear I had last night, not even kidding.
Oh.
I had to do a manual disimpaction on someone last night, 5 minutes before my shift ended. It was horrible.
You got in your car, you kind of smelt a little different.
No, never. The one thing I can't handle is poop, right? So like, of course, I had to do that. And one of the nurses is there with me because you have to chaperone, and she's cracking up, obviously like not in front of the patient, but like I'm dry heaving doing this because I can't handle it. But I also can't sign out to my senior, like the next person coming on, a manual disimpaction at 7 a.m. for them to do, hey, welcome on shift. I got this lady. I need you to stick your fingers up her butt, you know?
It's that moment when you see the people and they're smirking behind their mask.
Yeah.
And you're like, oh my
no.
God.
Yeah, so I don't really like that one, but I just don't do poop very well. I just can't handle it.
I completely understand. I'm the same way, but with vomit. This lady tried to vomit on me, and I think I just like jumped backwards. Because she looked at me and she was just like, ugh. And then she just looked right at me and I was like, shot back. Like,
like why did they do
I was
that?
out of the room before I even realized it. And I was like, which I went and got her a pad, put it down on the ground, and then she threw up on the pad. So then I was like, not picking this. I was like, I don't know if I can pick this up. I just put another pad down on that pad.
Yeah.
And I gave her a bag. And then I came back and there was throw up on the pad. I was like, what just happened here?
Yeah.
Oh, so I'm sure everybody listening was enjoying this.
Yeah.
All right. I got one. Why EM over any other?
I feel like, you know, I knew I'd always work in a hospital, but I wasn't really sure like what I would be doing in the hospital. And then I just realized the type of doctor that I wanted to be. Sure, internal medicine doctors can, you know, like stabilize patients during what they call rapid responses. Like when there's a patient that's admitted in the hospital on the floor and something's going wrong with them, the internal medicine doctor is going to respond to that. But at the same time, I chose ER because the variety, right? You know, when I was in undergrad, I saw there was this car burning on the side of the road and this car like sped up there and I was like super close to it. And this guy got out of his car and he's like, I'm an ER doc. Is anyone hurt? And I was like, the psych doctor's not doing that. You know, he's a psych doctor specialist, right? I mean, their training is just different. And in my head, I always wanted to know a little bit about everything and be like, the best case scenario, if you're on a plane and you need a doctor, is probably that you have an emergency doc.
Yeah. That's what they're hoping is on this plane.
Exactly. And I mean, that's no disrespect to the other specialties whatsoever. Like, sure, if it's a cardio complaint, I hope it's like a cardiologist, right?
Yeah.
But by the same token, it's just like that variety is so important to me. You know, having a 10-year-old kid with a broken arm in one room, next room is like alcohol. But like the whole thing is like all of these things are combined too, right?
Yeah.
So you're seeing all of these complaints at one time, and some of them are happening at the same time. A guy who has a laceration because he was too drunk You know what I mean?
Yeah.
And like doing all of these things for these patients and knowing what to do, where they need to go, how stable they are. You know, I don't know. I love that aspect of how much you need to know in the variety to like be able to stabilize every different kind of patient that comes through your door.
Mm-hmm. Yeah. And it's the difference of, like we were just talking about it, is that ER physicians, they're calm when shit hits the fan almost, you know, like when there's like a lot of wild things going on, which would be in a public disaster or something happening in the public. They're the ones that are going to definitely be the most calm. Like, I mean, for example, my mom is an ER physician and she was at a wedding one time and this lady starts just having a seizure. She just drops and everybody freezes and they're like, oh, is there? And then she's like, oh no, I got to go over there.
Yeah.
If you knew my mom, she would be like, she like tries to hide at first because she just doesn't like everybody.
Like, is there another doctor that's going to step up? Yeah. Because I'm going to chill here.
She would rather nobody know that she's a doctor until there's an emergency. And then she would step up for the emergency.
Exactly.
So she was just like, oh no, I gotta, like.
It's better that way for sure.
She's having a seizure and she pees on herself while she's in a dress. So it kind of gets all over the floor. And my mom is a female. So she's also in a dress at this wedding. So she's got like urine all on her knees. And she's like taking care of this girl. And she's just like, it was so funny because she was like, just another day in the neighborhood. She just laughed.
Exactly.
Like, so many people would just be like,
ew, gross, I'm not touching.
And then not be able to do anything for the rest of the day. She was like, what is,
Yeah, exactly. I mean, what did I do? I literally, after I did this manual disinfection, I washed my hands. I took off my 3 gloves. Guys, if you ever have to do a disinfection, you always wear 2 to 3 gloves, okay? I'll let you think about that. Why, okay? That's a pro tip. Never do anything different than that, okay? 2 to 3 gloves minimum on the disinfection, okay? But what did I do after I did that this morning? I went, I washed my hands, and I ate a sandwich.
I did.
You know?
No, I love it. That's awesome. That means you were made for this.
Yeah, exactly. It's the process, baby.
Yes. So we were just talking about, you have a tip for everybody. So Joel is notorious. He's a hustler, and we'll get to the hustles. He's got plenty of side hustles, but give your tip, your financial tip.
So this guy was, one of these attendings was telling me about this new glioblastoma treatment that they injected like he was going off. He knew this thing inside and out. And I was like, okay, apparently there's a stock. It's called like OTC. It's trading at like 67 cents right now on like Ameritrade. And this is not financial advice, guys. You need to do what you want to do with your own money, right?
He is not going to be held responsible.
I am not liable for anything that happens to your money, okay? And listen, in this attending, he was telling me, he's like, yo, this OTC thing, it works. Basically, they showed an increased growth in these glioblastomas, but what wasn't happening was they weren't dying within the 2 to 5 year period that they normally do after the diagnosis. Listen, I can't get into all the specifics about like the tumors and the tumor markers, what specifically it is. I really don't know. And this is just,
half the people listening won't care anymore.
Yeah, exactly. Anyways, so it's called OTC. It's a new treatment for glioblastoma. There's an increased 10-year survivability when they're using this. It hasn't been released to the markets yet, but they patented this process on how they do it, and it should be releasing within the next year or 2 years. And even if you put like $200-300 in, you'll probably make a pretty good ROI. But that's from my understanding. Once again, you could lose all your money. Don't go putting your life savings in. Okay?
Yeah. I'm gonna hedge my bets on you and just hold you liable. That's interesting though, because that's what you really want to look for is like a blossoming new company, especially when you're doing stocks. But then when you understand like the progression of medicine, that's a huge thing. If you can prolong life 10 years, that's a huge thing. And what's interesting is like medicine and technology is like everybody's laughing at me. I'll plug my my electronic stethoscope that I use right now. It's like medicine is progressing, and you know, when I have like a really obese patient, this electronic stethoscope that I use, it's called an Echo. Link in my bio on all my socials. But real talk, this, like, I didn't believe in it either until they sent me a scope, and I put this scope on the back of, you know, these people's lungs, and
you hear breath and heart sounds. You know, as a med student, you will relate to this because half the time we're like, do you hear that rail or that rhonchi or that wheeze in the lower right corner of the lung? And you just nod and smile with the blank stare. Like, I hope he doesn't ask me anything else because no, I didn't. But I'm just saying I did.
I heard something weird.
Yeah.
I don't know what to call it.
Yeah. No, exactly. Fluid. What was it? Is it a tumor? I don't know.
And then eventually you get the hang of it. And even still, like if you're using, like I remember at St. George's, they gave us a stethoscope.
Right.
And then when somebody else bought me like one of the Lipton's, like the nice ones.
Yeah.
And I had no idea the difference, like in the sound quality. It was night and day.
But this is what I'm saying is like, even with like, I had a Littman before I had this, and now I have a Littman with this noise amplifying technology and noise canceling technology.
Oh, that's
and you
nice.
can like increase it or decrease it. You can hook it up to your headphones. It's incredible. Like it's new technology that is changing the way you hear things. And I can tell you one thing. If you have a patient that's coming into an ER, they're not stable, you got to hear if anything's going on with their lung or heart, quick assessment. They have all their clothes on. They're obese. It's tough with a regular stethoscope.
Yeah,
like
it is.
So it's easy. You have to make life easy. And in my opinion, the Echo makes it easy.
I've seen people also use that. And then at first I didn't realize how beneficial it was. And then I saw another student use it. And then I think it was the resident or the attending was talking to the cardiologist. They were talking about the murmur. They were like, there's something going on. And then they were like, oh, and the student just was like, oh, I have a recording.
Yeah.
That was just my patient. I happened to just record it.
Yeah.
And they just played it. And it was like they knew exactly. It just helped with the whole process. I was like, I had no idea that could be so efficiently. And you can even save them too. So if you heard something that was very unique and you wanted to show it to somebody later.
Yeah, exactly.
I mean, I don't know.
They're integrating it with like EMRs slowly as well. So you'll be able to like
just add it.
I mean, even like using Epic right now was so interesting. They gave us phones to use for work. It's a gift and a curse because I just had a nurse Epic chatting me and I couldn't open it for whatever reason because I wasn't on the network. But long story short, they're like, oh, this patient has angioedema. Take a picture of it and put it in the chart. And I'm like, what? You know?
Yeah.
So you're just adding pictures of things to charts. And like when it makes things easier. Like I had to consult podiatry for a foot the other day and I uploaded pictures and put them in the chart. And the attending asked me, he was like, oh, did you put the pictures in the chart? And I was like, yes, because I was taught. He's like, oh, good. Call podiatry. They probably won't even have to come down and look at it if the pictures are good. Yeah. You know?
That's awesome. Because sometimes you have to, like the hospital will have a camera and then it has to have that specific camera.
Yeah,
it's so difficult.
Yep.
The camera's dead.
Exactly.
Oh, technology has drastically improved, and it's really amazing. I need to get me one of those Echo.
Yeah. Well, maybe we can talk.
The issue is with my stethoscope, and I don't know if you ever had that problem, but when I put it in my ear, I almost have to pull up on it so that I can hear. Like I can't just like let it dangle and still hear. So like if I'm using my other hand, I almost can't hear in my stethoscope. So I'm like, oh shit. I was like if they're a heavy person and I'm holding them and using my stethoscope, I'm like trying to like use my shoulder to lift it up in my ear. So I'm might have to look into that one. I was gonna ask you if there were any helpful tips you had to securing like your residency and for other people that are in that position. Because now you just went through the whole process.
In my head, okay, if you are a good person at heart, you have good intentions, and like especially if you're trying to get like an ER residency, the standard letters of evaluation that you get are going to grade you on, you know, things like how active was the student, were they sitting down a lot, you know, all these different things go into these letters that tell you not only how you work, but like how your presentations were. So there's a little bit of academic, but it's also like an evaluation of you as a person, not just like the medicine side, right? And being hardworking, being polite, being nice, being easy to get along with, showing up on time, all of those things I think really matter. And you have to do the basics right first. And if you can't do the basics right first, you're shooting yourself in the foot. And I think when it came to interviews for me, you know, my board scores were on the lower edge of normal for sure for my specialty. But by the same token, I interview extremely well. So, I mean, I ended up with 10 ER residency interviews and 2 internal medicine residency interviews. And I was nervous for the first couple interviews. Thank God they were the internal medicine interviews.
Yeah.
But,
yeah, you got to get the first couple out.
Yeah,
You just want to pick some low ball.
And then even my program that I matched at, they started off the thing, Joel, serious question. Do you think a hot dog is a sandwich or not? And I was like,
put it in a bun.
Yeah, I was like, well, there is bread on both sides. And I was like, are we serious? Are we doing this right now? And they were just asking these random funny questions to like throw us off at first. And I just really liked that vibe. And then they like eased us into like some more like better questions. And, I don't know. But like, once again, being a people person and realizing like everybody's just a person at the end of the day is like super important. So
yeah. What'd you say? Is it a sandwich or not?
I said, I guess technically. And a bunch of them went, no!
Like the residents?
No, it was the attendings. My program
they were
director.
like, you've gone to the dark side.
Yeah. I was like, I don't know. Like, I'm not from here, so.
It's very, very interesting. I don't know. I might have said yes as well. I mean, bread on both sides.
That's a good argument with meat in the middle. What constitutes a sandwich?
Yeah. I don't know what does constitute a sandwich. What was the strong spot on your application?
I mean, very honestly, like, I was very articulate in what I said in all aspects of my application. And what do I mean by that? There's all these different sections that ask you, explain your volunteering experience in 150 words or less. And you're like, I can't explain anything in 150 words or less, much less in an application for a job
that I really want.
So, like, I took the time really to make sure everything sounded really nice and said what I wanted to say. And also, like, put it in a emergency context. Like, I made sure those things were really in there that showed, like, ER is what I wanted to do, right? And you're like, but Joel, how do you do that? It is in the way you word things. Like, I really wish I could just show you my application. But when they ask you the question, what are your hobbies? Don't put down things that aren't your hobbies. Don't put down, I like studying. I like, you know what I mean? It sounds dumb.
Heaven forbid anyone put that.
Like, you should put down the thing. Like, for mine, I put social media mentoring because I did a little bit of mentoring for my social media platforms, right? I put down cryptocurrency, self-improvement books, weightlifting. I'm a normal human. That's normal to have unique hobbies. Just because it's a unique hobby doesn't mean you're weird. Like, if you wanted to put down, I crochet, like that like, they'd be like, I have to ask this. What do you mean? Like, what do you crochet?
Yeah.
It doesn't have, like, put down something unique. That's an eye catcher. You're not weird. Like, be yourself. And everybody will always tell you that is be yourself. And you need to be yourself and trust the process and the vibes you get from that program. Trust the vibes you're getting because it's probably genuine.
Yes. Yeah. I think the key is if you're yourself, then you're going to find the right program.
Yeah.
If you're trying, like, people can also spot that out. Like, if you've met 150 students in the day, like, eventually you're like, okay, this person doesn't care.
Yeah.
This person is obviously, like, nervous. This person is whatever. And then there's that one that shines. And then you go, okay, well, this has got to be the person we take.
Exactly.
Because this person was nervous or this person didn't say,
Yeah.
While they might be, but if they're holding back or they're doing things, it really matters. Do you have any recommendations for, like, what people should do? I guess if they have a low board score, should they, is it just in the wording or is there anything else you can do besides
Well, I mean,
just
listen,
writing a good personal statement?
Well, you have to really make your, like, okay, so you have lower scores, right? So what are you going to do? Just write anything on your application? No, you need to take the time to develop and really articulate. And, like, I was studying interview questions too. Like, I was readying myself for various interview questions and what I wanted to say and how I wanted to say it. And, like, prepare yourself for like, why are your board scores low? That I did get asked that a couple times, and being asked that question is like super important. But that's also great because I had the standard letters of evaluation that really, like, those I think really showed who I was as a person and who they were getting clinically. Like, my clinical skills are very good. I'm a great people person. You're rarely going to have a patient that's going to say, Joel was an absolute jerk when he saw me and examined me. He didn't listen to my complaints and was not like last night. I guess it doesn't matter who calls the patient, but the patient's family member was in the room and she's like, will you call me when you know more in her scan? I said 1,000%. And I had a second and I called last night and like I was asking nurses who does it, like, you can do it. We can do it. Doesn't matter. It's really up to you. If you're slammed and I'm not, like, you tell me to call. But I called and I followed through on my promise. But that's the type of person I am. I follow through on what I say, and what I say means something, So if I say I'm going to do something and I don't do it, something happened, like a family member died or something,
Mm-hmm. So, and that means a lot, not only to the person, like if you say something and you carry it over.
Yeah.
That means a lot for them. That means a lot for you. But then for some reason, even in your future interactions, that carries over. Like there's almost like a weird kind of, like people understand that you're a guy that follows through with their actions. If you keep sticking to it, like you can just feel it in the present. Like, have you ever met somebody and you're like, oh, like I trust that this person is going to do whatever
what they say they're going to do.
Like you just know without a doubt, like he's not going to, he's not going to fall through with that. And
straight up.
So if you stick to that it just shows. Did you ever get a wild interview question? Like what was the weirdest one that you didn't know how to answer?
Oh, okay. So this is actually a good one. I'm gonna pretend because this is good for you because you're applying this year, right? Okay. So hi, Jordan. Welcome to the interview.
Hello, sir.
So Jordan, it's a zombie apocalypse, and you successfully break into a drugstore that has not been looted yet. You have time to grab 3 different drugs, medications, or things from the pharmacy before the zombies come and get you. What 3 things are you bringing and why?
Okay. 1, lidocaine. I'm going to need some of that.
Why?
I'm sure there's going to be some injuries. I'm going to need to do some stitches.
Okay.
And 2, probably some pain medication because it's going to be hurtful.
Great. Okay, solid.
It's going to be hurtful somewhere.
That's good. Good.
3, maybe antibiotics.
That's so solid.
I don't know. That was all. Yeah.
That's actually really solid. So mine.
I was curious on the third. I didn't know until the very last second.
So I said I didn't say lidocaine. I said fluids. No.
Oh, I mean that's probably.
I said a bag of fluids, and I said pain meds, and I don't think I said antibiotics. I said some other random thing, and I told my friend that she interviewed at the same program, and she's like, oh, that one was easy. I chose antibiotics, pain meds, and she said some other, and she said like ketamine in case we needed to sedate someone for like a broken, I was like, oh my God, like you really thought of this. Like, I said, well, you interview well.
I did ketamine just to null out during the zombie
She's
apocalypse.
like, I also know the dosage at 1 mg per kg, and I was like, stop, we get it.
Oh my goodness. Yeah, or actually better, those little milk products that have like the protein and all that stuff? Might grab a couple of those bad boys.
Yeah, you're
like,
gonna need
it's almost a mini protein
No,
shake.
you get 3. You get 3, okay?
Those things that look terrible, like they're just like solid.
The
milk.
Ensures or whatever.
Yeah.
Calorie
like,
replacements.
I leave the pharmacy with that, and somebody just shoots me for no reason. Okay. Is there any tips that you have for interviews? Like I've heard you need a nice suit as a man, or like an outfit that you're going to wear that you look presentable.
Okay, I'm going to just say this and say this once, right? You apply for residency one time in your life. Don't take the picture for your residency application photo at home using your mom's iPhone 4, okay? Mm-hmm. Pay the money to get a nice photo. You're going to need it. You're going to want the memory. It's worth the $200. At this point, you've gone through med school. You have probably your hundreds of thousands in debt. Spend the $200 to get your photo professionally taken and put it on the thing. Okay?
Yeah.
Number 2, when you go and get that suit, you don't have to spend $1 million, but just get a nice suit and dress up nicely for your interview, no matter what. Make sure you ask your family members, hey, does this look okay? You don't want to go onto the Zoom and you need to check yourself before you go onto the Zoom. Okay. Look at yourself in the mirror and say, would this be a guy I would like to hire? Wear glasses in your interview if you can. They did some study that shows that an applicant was more likely to match into residency like 30% more of the time if they had glasses on in their picture versus
I wonder why
if they
that
didn't.
is.
Yeah, it must be an intelligence thing,
That's interesting. My glasses are always foggy.
Yeah. Good luck. You need to get that fixed, okay?
I'm just being stupid.
Yeah. And honestly, number 3 is just, it sounds dumb again. I'm going to repeat myself. Just be yourself in the interview, okay? They already picked you because something in your application stood out. They already want you, right? They already are considering saying, hey, this might be someone we would like. So they already extended you the interview. So just be confident and be real with them. Open up. I almost cried during the interview at the program that I matched at. They asked me like a really like weirdly, oddly personal question that I was emotional about. And they were like, tell me about a patient that you had a bad outcome with and how it affected you. And I was like replaying this patient that came in. She like syncopized after she was like walking off of a bus. She'd had episodes of syncope in the past. She came in, she didn't lose consciousness, but she was like disorientated. They called EMS. She had some bleeding from her nose. Other than that, came in, blood pressure was a little low. She had some like history of some fatty liver disease. And I just remembered one of my like senior residents when I was a med student at the time. He told me, he's like, wow, that's a really big vein in her neck. And it was, I remember it to this day. I remember what room I was in. I remember what hospital I was rotating at. And I remember this like pulsating vein in this lady's neck. I was like, yeah, that doesn't look good. But I didn't put 2 and 2 together, right? I didn't say, wow, like she has fatty liver disease. She might be bleeding from a varice, and something happened with the CBC was missed by a draw was missed. Like I met her son and I said, we're going to take good care of your mom. And I left for work, or I left for home like 4 hours later, and I came back the next day and she had been transferred to the ICU and she passed because she was bleeding from a varice and it was missed. And it's like, it was just one of those moments where I was like, I will never miss that again. And they said, like, tell me about that experience and what you learned from it. And I said, I feel like we're all human. And from the doctor side of things, we all miss things because we're not perfect. But at the same time, we have this large responsibility as doctors. And there's a lot of pressure to do well and try to do everything right the first time. But that doesn't always happen. And that just goes back to being human, right? Mm-hmm. And knowing that we're doctors and we're also human, and finding that fine line of, I'm a doctor, but I also make mistakes is like kind of a hard thing for people to grasp. And when I think about, telling that son that we're going to take good care of your mom, I said to myself, did I take good care of her? And that's something that I feel like I live with, and I've lived with for years now. And when they asked me that interview question, I was like choked up because I was like, I knew that. I had the knowledge and it was there. And not until they said, well, she had a history of fatty liver disease, that I put 2 and 2 together, that she had sort of portal hypertension that was causing her to bleed from a varice.
Yeah, that's tough. My goodness. Yeah. Cause it's those moments where you feel like hopeless, and like where you're like, I desperately want you to survive.
I honestly think that's what makes you right for medicine, though, Jordan. Is like you are compassionate, you care, and you have a sense of that just makes you a real human being. I wouldn't go changing your Instagram handle to The Real Dr. Abney or anything like that.
Yet. But maybe in a year.
But listen, you have a good sense of self, and I think that'll carry you far. And I think interviewers are going to love you.
Yeah, I probably need to change my Instagram handle. It's still like Big Ass. It's like my high school nickname.
Yeah.
Oh, also tip 4.
Yeah.
Do we get a ring light?
Dude,
I've heard.
Listen,
I got bestowed one because someone knew I was going to be doing interviews, and they're like, "You'll need this."
It sounds dumb, guys. I don't care what you look like, but if I'm an interviewer, I care who I'm looking at took the time to say, I want to look my best for this interview and give the best impression I can. And if you're dark and I can't see your face, how am I supposed to see your facial expressions or really interact with you? As a people person myself, I do really well when I see people's reactions and expressions well. If I can't see you expressing, or I can't catch the tear in the corner of your eye because you're getting emotional, like how am I supposed to connect with you? or empathize with you or feel any type of way. You know, it's like it's setting yourself up for success. You got the picture, you got the application, you got the ring light that makes you look good.
Light,
you know what I'm saying?
Everything.
Like,
it all matters.
Yeah. And I
because
think
it's every bit of the process is a weaning out, like a filter.
Exactly.
So you've got to be at the top every step of that filter.
Yeah. And it sounds dumb, but somebody once told me, listen, in life, everything matters. Mm-hmm. And how you do anything is how you do everything. And I said, oh my gosh, that's like so much pressure.
Yeah, I know. Yeah, they just
That's such a
bestowed
weight.
a lot of wisdom on you. You're like, shit.
Yeah, well, and that's, listen, and that's even like, when you throw, no one's around you and you like go to throw something away in the garbage and you miss and you're like, well, I could just.
Yeah.
I always have to pick it up. I can't.
Too. I'm weird like that.
I just can't.
First, I'm like, I got to get my rebound. But then I'm just like, oh, shit. Like, I just can't just leave it. Even if it's like a gas station, I'm like, oh. Because then there's always somebody that saw you or even still, I'm like, whatever.
It's a certain type of person,
Mm-hmm. Now, you haven't spent years as a physician, obviously.
No.
But even still, people get burnt out in medical school. People get burnt out throughout this whole process. Like, even me, I knew that I was burnt out. Like, at some points, I was like, for the love of God, I have to listen to something other than medicine.
Right.
Like, I cannot, like, I've just been listening to medicine and I made it like that. Like, I was like total immersion before a test. Like, I don't do anything else besides medicine so that there's nothing else in my mind.
Mm-hmm.
And then though, I was like, for the love of God, I have to step away.
Right.
And how do you prevent like burnout during this time?
Oh, I have to like be in the gym like 3 times a week. I think it's really important that, what I've realized is in this short 1 week of working as a doctor is like when I look in the mirror after I like take a bathroom break, which happens like 5 seconds during a shift, right? Like I want to like who I see in the mirror. And I feel like that says a lot about the confidence you bring to the table. If you can look at yourself in the mirror, you can have confidence in what you look like and how you feel. You're going to also have confidence in what you say and how you say it. And I think that's a big deal. Self-confidence speaks more to everything, in my opinion. Mm-hmm. And, I hope that answers your question.
No, that does, yeah. All right, one last question. We'll do some rapid fire and we'll wrap this up.
Let's do it.
Were you glad to go to St. George's, like to be an international medical school?
Yeah, I don't think I ever knew anything different, right? So I didn't know about DO schools. I didn't know. Do I regret it? No. Am I glad to have gone there? Yes. Do I think things could have gone a little smoother? Yes. But looking back, I wouldn't trade it for the world,
Yeah, I like that answer because it's very similar to mine. Like I absolutely loved the experience. It's just a matter of things could have certainly gone smoother.
Yeah.
Yeah, like there's some bumps. It makes things a little bit more touch and go.
Yeah.
But okay, so we got a couple of rapid fire questions.
Let's do it.
I'm going to go. Okay, if you could pick one job out of medicine, what would it be?
And I was asked this during interviews, and I don't. Oh my gosh.
What a question to ask in an interview. Like,
they ask
for medicine?
That.
I know.
They do that all the time.
If you didn't do this job, what job would you be doing? You're like, I'm applying for this job. I feel like I didn't give that any consideration when I applied.
I feel like I'd want to be like a professional athlete.
Yeah. Okay. Like WWE star? I could see you.
Yeah, exactly.
Okay. Nights or day shifts?
I really like being part of the day shift, but there's something about the night shift I also love.
Mm-hmm. There's a lot of fun that happens at nighttime for some reason. You're just like, one place that you could live outside of the U.S.
I feel like I'd love like Germany or Switzerland or...
One place that you could do medicine outside of the U.S. Like if you were going to do medicine somewhere else.
Yeah, probably somewhere like a European country.
Okay. Jersey, Florida, or Wisconsin? These are all places that Joel has lived.
I like all of them for different reasons. The drivers stink in Jersey. Wisconsin was a little too small town for me. Florida had a lot of things, but also like some bad things. I love the weather. I really do think I'm a warm weather person. I feel like I might end up in like North or South Carolina eventually, but if I had to choose, it'd probably be Florida.
Florida? What is your mid-shift protein snack? Because it's going to be protein.
Yo, the Trader Joe's have some bars that are very, very like delicious.
Okay.
Trader Joe's protein bars.
Trader Joe's protein bars.
Yeah, they're pretty solid.
Well, that's a great way to end this bad boy. So thank you so much, Joel, for coming. It's been great. You're always a blessing. Hope everybody has enjoyed it.
Yeah, this has been really great, Jordan. Thanks so much.
Of course. If you need to find him, he's the real Joel Collins.
Yeah, the real Dr. Joel.
The real Dr.
platforms.
Joel. On every platform. And yeah, anything else you want to promote or?
No, guys, just be kind and be humans. Be nice to everybody, okay? It's really important. You never know what people are going through.
That's perfect. All right. Thank you, everybody. Hey everyone, I want to take this time to tell you about our friends over at TrueLearn. They have this top-of-the-line test bank that is perfect for any upcoming board exams that you may have. They have test banks for all types of exams. So whether you're studying for medical school, nursing school, OT, pharmacy, and others like speech pathology, TrueLearn is the way to go. If you're like me and going through medical school, they have a question banks for all the big exams, like Step 1, Step 2, and Step 3, with quality assessments for each exam. Look, I know we didn't go into healthcare because we love taking tests. This is the hard part of the job. Make it easy on yourself with TrueLearn. Sign up now with the code OFFWHITECOAT to get $25 off your purchase. That's OFF white coat, no spaces, to get $25 off your purchase. This is a test bank that you do not want to pass up on. Make this easy on yourself. Take the deal, pass your boards, and get back to enjoying the reason you went into healthcare. And make sure to use Off White Coat when you pick it up.